So yeah, it's great to be part of this event, the first time that we've done this. This is, I guess, a non-CME tech update on a study that's going to be started soon. And so it's my great pleasure to be part of it, to be part of this study, and to introduce this to everybody here. So this is a novel injectable parathyroid hormone-based bone graft for interbody fusion. Do I have control? I don't seem to have control of the slides right now. There we go. So I'm going to go back one. So here are my disclosures. And I guess one thing that was not on this that's obvious is I am the principal investigator for this FDA study for this injectable product that's going to hopefully start this year. And so we do get research funding for it, but I have not gotten any personal conflicts from this at all, including for this talk. So what are we talking about? Fibrin PTH is a novel parathyroid hormone-based healing matrix, which has shown the ability to repair bone in different preclinical models for trauma. It has comparable efficacy in these studies to autograft and infuse, the sheet model for interbody lumbar fusion. It's met its primary endpoints in 2 randomized control trials in tibial fractures. And it has a good safety profile in both these preclinical and clinical studies. This fibrin PTH allows for a targeted, controlled bone regeneration due to its injectable formulation. It's particularly well suited for minimally invasive approaches that I'll show in this in some slides later on. And again, like I said, this product is being prepared for a clinical study, FDA drug study in the US. It was supposed to be up and running by now, but with COVID, things got delayed, but we're hoping to get this started by the end of 2020. So what are we talking about? There's a video on this. Here it goes. Great. So the company is Kuros. It's based in Europe. And they've developed a novel product to activate bone formation based on parathyroid hormone, PTH, which is basically Forteo. This PTH is linked to fibrin, but unlike BMP, the PTH affects cells that have already committed to bone formation and promotes the differentiation of osteoprogenital cells and the proliferation of these osteoblasts. PTH delivered systemically like Forteo for the treatment of osteoporosis has been used for many, many years, but its current form as a local form of biologic has not been used. So Kuros developed a way of linking a parathyroid hormone through this that's covalently bound to fibrin. And the reason for that is that when you link it like that with plasmin, there can be a lysis of the PTH that then releases it in a time-controlled manner. This shows the mixing of the fibrin with the PTH with that linker that they developed to allow for the parathyroid hormone to be delivered with the fibrin. And so again, we're all familiar with fibrin. You know, it's that goopy gel-like thing that you can inject. And again, the idea here is that you link parathyroid hormone to it so that you have an ability to release it in a localized fashion. So the idea behind this is that you do a normal interbody fusion as you normally would, but then you can inject this fibrin PTH in and around your cage and into the intervertebral disc space that you've prepared. And what happens over time is that, again, plasmin in the blood that will naturally occur in that area will cleave the parathyroid hormone and thus activating it. And then you get that natural action of parathyroid hormone that leads to bone formation. Yep. Just the video kind of illustrating this in a nice graphic. And again, the idea behind this is that it's a little bit downstream of where infuse is. So hopefully there's less robust inflammatory response and there's just less of a shotgun approach. And that's a little bit more specific to osteoprogenitor cells and osteoblasts. This is just another video. Yeah, just another video. This purple fluid is just liquid. And this just shows how the injectable kind of can go where you want it to in the cage and then directionally out of the cage.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.